Good morning. This is Michelle Smith. I am the State Coordinator for Action for Healthy Kids. I'd like to welcome you to our webinar on school health advisory councils and wellness policies. Today's webinar is brought to you by Action for Healthy Kids and our partners, the YMCA, Texas AgriLife Extension, TAFERT, Texas PTA, excuse me, and Dairy Max. We are all working together to support our school districts and their school health advisory councils. It's Time Texas has partnered with us for several years on the webinars and school health advisory councils. And we have a new member, Joycelyn Gerardo, who is the Director of School Programs. She joined in July, and we are excited to welcome her to Action for Healthy Kids, and she will be sharing information in the future about the School Health Advisory Council awards and other information on resources that they have on their website. Logistics, you can listen in on your telephone, or if your computer is equipped with speakers, you can certainly use those. All of attendees are muted, so there is a question box where you can submit questions and we will answer those at the end. If it's some type of clarifying question you think we need to address during the presentation, I will review those and see if we can do that. We are recording this webinar, so we will send out a link probably later this week or first of next week. It will be posted on YouTube and any resources, as well as a PDF of the slides. Okay. Just a little bit about Action for Healthy Kids. We've been around since 2002 when Surgeon General David Satcher said we have an obesity epidemic. So Action for Healthy Kids has worked for the last, over 15 years to try to help schools become environments where kids are healthy, active, and ready to learn. We provide breakfast grants, school health advisory council trainings, wellness policy workshops. We have an annual summit, which will be coming up next week, webinars, and then we also work with Partnership for Healthy Texas on policy at the state level. We have over 5,000 members across the state, and we have a very robust steering committee with all the disease agencies, all the state agencies, quite a few nonprofits, anybody that works in and around schools and are concerned about student health. Is invited to be part of our steering committee and help us find ways to improve the school learning environment. So Mario is going to talk about school health advisory councils. There are lots of laws that relate to advisory councils. All of these things have been set up to make it easier for parents to be engaged. And he will go through a lot of the different laws and information on SHACs. So I am going to turn it over to Mario.
Hello, everyone. This is Mario Reina. It's good to be here, part of the School Health Advisory Council's one-on-one. Wanted to share some information that has helped me with the McAllen ISD SHAC. And I do tell you that I've been privileged to have won some awards, and that's not a big slide that I really like to present, but I just need to share it with you because I do want to let you know that because of my involvement in SHAC, I think it has led to maybe some of these awards. And of course, when you have an outstanding staff, my physical education teachers, it makes it easy to get awards. But I do want to let you know that my involvement with SHAC has also helped for me to attain some awards. One of the big things that I always advocate is that you have to have a culture in your district that believes in the mission. And the mission of SHAC is well defined, that you can see it in board policy. But if you don't bring it into your school district and establish it as a culture, then it's going to be difficult for you to move forward. And in talking to a lot of colleagues and health and PE coordinators throughout the district and other health advocates, they do tell me that they struggle in their local school systems. And that is very common, and it's unfortunate because it's the law. And the big deal here is that if you're not taking advantage of what a school health advisory council can do for your district, you're missing out. And here on this slide, you just see that it's a BDF legal, it's a law. And I'm not going to go into that because it's well established. It's been in place for many years. And so there's a lot of support there. And keep in mind that when you have laws, then the school boards and local school administrators and community will always support you. Next slide. Once again, I will talk a lot about the culture at the beginning. And one of the things is, like we said, it's mandated by state law, appointed by, members can be appointed by the school board. And I always like to do that. And that way your school board will always have their ears to what you're trying to do. And the big deal is that you need to make your parents in the community know that this is an avenue for them to advocate for good health in your school system and in your community. And we all know that they are in place also to review any health related curriculum that you have. And recently there's been a lot of interesting topics that sometimes we do need our SHACs to be involved to help out. And we make recommendations on any health related topics to the school board. Now we know that healthier students are better learners. And that's one of the reasons that the district level advisory councils are in place to ensure that at the local community values are reflected. And one of the things that we do have the big one here, which I call the SHAC, but I also have on every campus what I call the SHAC, which is the Campus School Health Advisory Committees, which also help at the local level to give advice to us at the SHAC at the district level. Next. So here's one question I ask those of you that are out there. Is your SHAC active? And if it is it impactful? And it goes back to the culture that you understand the law, you know the mission. Do you have a history of success in using your SHAC? And what partnerships and relationships are you developing, especially with your parents and your community? And then something I always look at, the big A, you know, is there accountability? There's no accountability, then your SHAC, that might be what, when I talk to colleagues across the state, that might be one of the reasons why they're not having success in utilizing their SHACs. So that's why it's important that there's accountability and that you have action behind what the SHAC is all about. If you have it there, you just do it just to do it because it's a requirement, but nothing is happening, well then you lose credibility and you might as well not even have a SHAC because it's not doing anything for you. Next. So let me talk a little bit about accountability. Of course, when you have your SHAC meetings at the beginning, Michelle shared with you, like you're supposed to have 4 meetings, and those are minimal. And but when you do have those meetings, you should have agendas. That way you can always go back and refer to what's going on by having minutes. And that's been real helpful for me in the past, that we're able to go back and remember, like, oh, we talked about this. Why is it stagnant? Why aren't we moving forward with that topic? So it kind of helps us out. Now, one thing that I do, and not only do I do this with SHAC, but I also do that with my health and PE department, with lots of things that we do. I take advantage of the school board meetings. That's what they're there in place. And once you get to a school board meeting and you talk about SHAC, that means that you're documenting. And that's very important. And it's also letting your school board know about what's going on with your local SHAC. And over the years, it's not a requirement that you have to go before your school board when you give reports, but because you can do an annual written report. But for me, this has been a major best practice by me going to before the school board. And honestly speaking, I think 2 years ago, I went 4 times. And I was going before the board after each SHAC meeting. I thought it was too much. And I think our school board and my superintendent realized it was too much. So now I'll either go, depending on what's going on, I'll either go in the fall or in the spring or both. But one thing I do want to let you know that if you want ideas on how to set up, use your website also, your district website, to help you. And if you want to get some ideas, there's plenty of school districts out there with wonderful ideas. But the McAllen ISD website, I do have some information there that can help you also to put information on your SHAC on your district website. Next. Here's going back a little bit about the accountability. I just wanted to share some samples there. You can see on your left side of the screen, you see an agenda and you see what we're talking about. We usually have like at least 4 reports at every meeting and sometimes more. And it goes back to what are some of the requirements in the SHAC that you want to address. And the second one, you see the minutes of one of the meetings we had back in February of 2018. But you put in as much information as you can to document. Accountability is very important. Next. And here's some more accountability. You see right in the middle, you see the school board agenda 5, how we went before the board. And then on the right side, you see my presentation script, the slides and everything I talk about. Usually what I do when I go there, I have what I need to say and I read something and I do that as a strategy. That way I don't have to go back and say, oh, what did I talk about? No, whatever I said at that meeting, at the school board meeting, is going to be the same notes that I will have later on to refer back when I need to go back. Now on your left side, you will see once again, when you get the PowerPoint presentation, you can easily go to our website or do a Google search for McAllen ISD website. And I have it under academics. You'll see at the end of the presentation where you can find this, but it's a real simple, informative website about what's going on with the School Health Advisory Council. You'll see agendas, meetings, and other important information that I think it's good for parents and it's good for the community. Next. Okay, let's talk a little bit about action. And that's something that I like to talk a lot about, because when we have meetings, and especially like when we go to Tayford or when we go to other meetings with people that I work with throughout the state, and we bring up the SHAC, and lots of times they say, there's some school districts that are doing wonderful and they utilize the SHAC to help themselves do some real nice wellness initiatives. But there's a lot of districts out there in the state, and I would certainly welcome, I know we do some surveys on it, but more and more I see that there's a lot of SHACs that are there just to be there, but they're not actually working. So one thing we did, just a couple of examples of some action that happened thanks to the SHAC. And I'll tell you this, I'm a health and PE coordinator, and if I would have gone there by myself as only the health and PE coordinator, I would have gotten nowhere. But because I came through the SHAC and some parents and some influential people that were on our SHAC, it made it easy for us to do like a district wellness policy, some SHAC resolutions. We now have like a wellness compliance report where the school, our schools here in the district, they have to report it. We're in compliance with like minute requirements in PE every 6 weeks. If we're not, for example, if recess, if it's not taken away as a punishment, what's going on with food services. So it's a really nice document that helps us to have some accountability measures in place with our principals, because we do understand, I've been around a long time, and we all know that the principals, their evaluation basically goes a lot to what? To academics, to how are we doing with standardized testing. So that's why it's important that we have this in place. And one thing that I have a boss that she actually ended up putting, she wanted to see if they were in compliance. So she put this like in the evaluation at the end of the year for principals. She wanted to make sure that they were compliant within the wellness compliance reports. Also, as we talked a little bit about the It's Texas Time, and Jocelyn, you know, we know, those of you that have been involved, It's Texas Time has been great for us. A little bit off cue here, but just to let you know, I know what it's done for our district as far as staff wellness and the It's Time Texas Challenge and other great things that come from there. But that the award that came from there, they did recognize us at McAllen ISD as one of the 5 best SHACs 2 years ago. So that's really good. course, active schools is good. And of course, I always advocate for the Alliance for a Healthier Generation because they have a lot of modules and criteria there that help you with the overall comprehensive school health that you want to be having in your school districts. So that's something that if y'all want to ask me later on, you can always email me when I share my contact information at the end of this presentation. Next. Once again, here's some examples of action plans. You know, we have in our FFA local, we included our district wellness plan in there. And then we also, if you go to our website, you will see our wellness compliance plan where we require, what we require from the principals at the end of every 6 weeks. Now, because we needed to initiate that from the SHAC, we did that and it worked out very well. We had it for 2 years. It was a lot of work. It's a lot of work on my part too, because every Wednesday after the 6 weeks, the first Wednesday after the 6 weeks, I was getting all the documents from all the schools, and sometimes you have to remind them, but it was good to have them there. So now this year, everything's been good. So now this document that we require is only going to be required twice a year. So you can see the impact that had. Of course, a SHAC resolution is always really impactful. And you can see a sample right there on the right side that we got from the SHAC that helped us to continue our partnership with the Alliance for a Healthier Generation. Next. I'm ready for the next slide, Michelle. There you go. Thank you, Michelle. Here's that wellness plan compliance, or it can be called a wellness compliance plan. That's what I required from every school. And that's where we held them accountable to make sure that the goals that we had in place were being followed. And that happened at a SHAC meeting when one time we had a complaint by several parents that didn't like the fact that some of our kids in our elementary schools in McAllen ISD, our kids go to recess 20 minutes before lunch. And at some of the schools, a couple of principals were taking the kids out and they were using it as punishment, no recess if you didn't do this and that, this and that. And at that meeting, I had heard that the same complaints that I had from my PE coaches, but I didn't have any documentation. So I was really like, oh man, this didn't feel good, but I told my SHAC, it's not gonna be the same. Give me some time. With your support and endorsement, we'll create this. Are y'all willing to move forward with it? They said yes. So then we developed this wellness plan compliance report, and everything has been a lot better. I hear from my PE coaches that kids are not being taken out of recess or that we're in compliance with minute requirements. So that's just a small sample of how powerful SHAC can be for you if you utilize it. And on the right side, I talked a little bit about the year 2018 where we were able to get an award. And everybody should look into that because school districts are always looking for recognition at the statewide level, and they have a tendency to celebrate. But for me, I'm looking at it as, hey, thank you, It's Time Texas, for having that and giving us this opportunity to shine. Next. And here's just a page that came out on our website. You can see there McAllen ISD, and it's a good thing. And it's also came out on the It's Time Texas website. And I will guarantee you, on some of the school board members that you see there on the right, I'll send them a little text and say, hey, would you like to please do me a favor and go check this out? And I don't even tell them what it is. And they're always like, okay, what is Mario up to, right? And then they go check. It makes McAllen ISD look good. And they're happy about that. So then when I come before the board, they're willing to always be real supportive of what we are doing. And you know, when you're in front and you're doing a presentation where it's all about what's good for kids, the health, the parents of the kids and the community, who cannot have open ears to something like that? So it's a win-win. But if you're not going before the board to share what's happening, then it's just not going to go anywhere. Next. And of course, everybody that I've talked to has always talked about how you engage parents. And some best practices go back to if you develop a culture that you are a member of something that's very important and you get them to believe in your mission, you don't have to worry about engaging parents, okay? Like for example, this year in my participation, I have 26 members. And out of the 26 members, there's 18 parents. And from there, you cannot do everything at a regular SHAC meeting. So we have subcommittees to try to get them together. Now, I do have like a SHAC members. Those are one group, but because we have a lot of other people within the district that are real interested in the SHAC, I have what I call the advisory committee. So there's a lot of members there from within my district that I have there, but I don't want them to be voting members because I don't want my school district to dominate what's going to be happening at a SHAC meeting. So when you see this stat right here, you know that those 18 parents are real happy that they feel that they have a voice in our SHAC. And of course, every school district has an opportunity to apply any new strategies you have. We have they call it a parent university, where there's a lot of meeting with parents. And usually sometimes I go to those meetings and I try to advocate for parents to come, that they don't have to be members of the SHAC or be in a advisory role. It's open door policy. Come out, join us, voice your concerns, and we move forward. Next slide. Of course, this was a couple of years ago at the Time Texas Summit. And you look at the left, those two wonderful ladies that are with me, both of them are parents in our school district. So I went as a district representative, and I had two parents that went also to that It's Time Texas Summit. In the middle, of course, it's a politician, our local senator. It's good to have them involved. And of course, a lot of you already know the Tayford Executive Director, Rose Haggerty. She was there. And on the right side, it was the other SHACs that they were privileged to be taking a picture with us, McAllen ISD, because I'm just messing around there. Next. Yeah. And here's some SHAC resources that I've used in the past. There's a bunch more than this, and maybe Michelle can share those with you. Yes. But these are the ones that we've referred to, and it's been real positive for us. Also, we have at the state level, the TSHAC, and it's a wonderful committee that's always been real supportive, and they set a lot of, especially some position papers that have helped me. And of course, I always tell my parents, get active. Next slide. And here at the end of the presentation, just to go back to the McAllen ISD website, you can see, you can find the link to my SHAC. I have it in two different areas. And something that helps me being with a district at my level is that I'm able to put information into our website. And not many of our coordinators or directors are able to do that. But because of the SHAC, and they do know, I tell them it's really important because I need to communicate with parents. I need to communicate with community. I'm able to go to our website to add information. So under academics, you go to the health and PE link, and when you hit that, you'll be able to see another link that will tell you about the SHAC link. And it's also under the parents link, where you go and you'll find the SHAC link, and you'll see that I try to provide as much information as I can. And any given moment, my name once again is Mario Reina. There's my email, which is Mario, M-A-R-I-O, .Reina, R-E-Y-N-A, at McAllen ISD, it's all together, .net. Or you can always call me at the number that's right there on your screen, 956-928-8939. And, I'm always willing to share whatever I have, because whatever is good for my district and the wellness of our children, our parents, and our community can be good for any other school districts, not only here in the Rio Grande Valley where I'm at, but anywhere in the state of Texas. And that concludes my presentation, Michelle.
Thank you so much. I apologize for the slow response. It seemed like my screen kept locking up on me. And I was pushing the button and it wasn't moving. So thanks, Mario, for sharing the success you've had with your School Advisory Council and the continued success. I know it's challenging to keep going, and having someone like you that continues to commit your time and your passion to the School Advisory Council is one of the reasons they've been so successful down there.
Michelle, as you go into the next one, I did want to let you know that with attendance, sometimes it's so hard to get parents there, but right. Our meetings were like 5 p.m. because maybe they worked. but we had to move our meetings, and now we're having real good attendance. And I don't know, this is a suggestion, is that we now meet at lunchtime and we feed the group. And that seems to work. So I wanted to make sure I would share that as a best practice that's helping us out. Thank you.
I agree. I mean, I think it's different for different communities. We've been successful in Austin meeting at 6:30 in the evening and feeding them. And I'm not sure if it's the meeting time or the feeding them that works the most, but you have to find what works for your parents. I've heard of several districts that are meeting at lunch, and that has seemed to work for a lot of people. So it does make a big difference. Thanks again, Mario. So one of the things Mario mentioned that is critical that school advisory councils work on is wellness policies. This is a federal mandate for any school district that has it's part of the school meal program. And because the school advisory councils are mandatory in Texas, they are the perfect organized group to deal with wellness policies. So today we have Helenka Ostrom, who is going to share what and how the Department of Agriculture is supporting work with wellness policies. Helenka, I think you're unmuted.
Great, thank you so much, Michelle. Good morning, everyone. Thank you all for attending this webinar and learning more about SHACs and local wellness policies. My name is Helenka Ostrom, and I'm from the Texas Department of Agriculture, also known as TDA. The Texas Department of Agriculture's Food and Nutrition Division administers 12 federal child and special nutrition programs for the state of Texas, including the School Breakfast Program, National School Lunch Program, and the Summer Meal Programs. TDA supports providers of nutrition assistance by helping to ensure accountability and the efficient use of taxpayer dollars to nourish Texans in need. These nutrition programs exemplify eating right for Texans of every age and background and help them build a bridge to success. TDA facilitates a local wellness policy advisory committee, which is comprised of state stakeholders. The goal of this committee is to provide resources and support to school food authorities for developing and implementing impactful and sustainable local wellness policies. One objective is to provide local education agencies with resources, training, best practices, and implementation strategies for local wellness policies and for the wellness plans. Next slide, please. For today, we are going to be discussing the following topics: the requirements of local wellness policies, how to transition from a local wellness policy to an implementation plan, and the resources that TDA Food and Nutrition has to support the development of local wellness policies and plans. There are a few key years that have shaped local wellness policy requirements. In 2004, the local school wellness policy requirement was first established. In 2010, the Healthy, Hunger-Free Kids Act strengthened wellness policy requirements and improved transparency to the public on school wellness policy content and the implementation of wellness plans. In 2016, USDA released final guidance for wellness policies. The final summary of the rule can be accessed via the link on this slide. Next slide, please. I want you all to take a few minutes to think about how you would define a local wellness policy. For the purpose of today's presentation and providing a clear definition, I would like to share USDA's definition of a local wellness policy. A local wellness policy is a written document of official policies that guide a local education agency or school district's efforts to establish a school environment that promotes students' health, well-being, and ability to learn by supporting healthy eating and physical activity. after hearing this definition, think about how this local wellness policy definition applies to your school and how you could interpret this and create change in your district. Next slide, please. Schools or local education agencies that participate in the National School Lunch Program or School Breakfast Program must have a local wellness policy. The local wellness policy document must be approved by the school board or governing board. In the state of Texas, the Texas Department of Agriculture reviews local wellness policies every 3 years during School Food Authority administrative reviews. One key point to note is that though a local wellness policy must follow federal and state standards, schools do have the option to develop stricter guidelines in their local wellness policy. For example, schools could restrict the sale of sugary beverages more so than the USDA requirements have, and they could also limit the number of food fundraisers that their school district and their different schools can have in a year. Next slide, please. The local wellness policy document outlines what the school policies are at the district level. This document identifies the following topics: nutrition promotion, nutrition education, physical activity, school-based activities that promote student wellness, and food and beverage marketing. The local wellness policy contains goals that the school will strive to complete at the district level. Next slide, please. Now, the implementation plan describes how the local education agency will implement the written policy. The implementation plan should focus on the local level. So meaning you have the local wellness policy that applies to the entire district, but the implementation plan should be really focused on the local level. You could have individual wellness plans for each school, depending on the size of the district, and really hone in on what the needs are of those schools. It should also be updated to meet emerging needs and the priorities of the community, in addition to addressing the local, state, and federal requirements. Next slide, please. The wellness implementation plan can be developed for the entire school district, or it can be unique to each individual school, depending on the size of the district. The SHAC can talk and figure out what is most appropriate. School size and the resources available can determine if the district has one wellness plan or unique plans for each school. For a small district, the School Health Advisory Council, the SHAC, may serve as the wellness team for all schools within the district. There are some schools that are extremely large will have the SHAC, but then they may also have smaller wellness teams to cover some of their schools too. The implementation plans have local campus emphasis and are creative and innovative with activities that start small and then grow over time. The implementation plan is approved by the respective school administration. So doesn't necessarily have to be approved by the school board. Next slide, please. This document, the Policy to Plan Guide, was created by TDA's Local Wellness Policy Advisory Committee, and it's available on TDA's Food and Nutrition website, squaremeals.org/local wellness policy. It defines the wellness policy and the implementation plan as well as identifies differences between the two documents. On the second page, it describes how to transition from a written local wellness policy to a wellness implementation plan by engaging youth, parents, community members, and school personnel. As you all know, effective partnerships and collaboration between the School Health Advisory Committee, school administration, and stakeholders are necessary to ensure the district is building a cohesive school health environment that incorporates local community values. And this policy to plan guide can be downloaded. It's available as a PDF. Next slide, please. The Texas Department of Agriculture's Food and Nutrition website has a variety of local wellness policy resources. These can be accessed if you go to squaremeals.org/local wellness policy. On the website, you will find a description of local wellness policy requirements and additional resources from TDA. TDA resources include an administrator's reference manual and local wellness policy checklist. The Texas Department of Agriculture provides local education agencies with the administrator's reference manual and a local wellness policy checklist to assist during the implementation of the local wellness policy goals and objectives. And the web page also provides links to partner resources that support the development of local wellness policies and implementation plans. There's a policy template from the Texas Association of School Boards that can help with the framework for the local wellness policy. They also have a template as well for a wellness implementation plan. We also have resources from Action for Healthy Kids, resources from USDA, a link to the WellSat assessment, which can help review wellness components within the school, and many more. So I encourage you to check out the website. I hope you find all of these resources useful. If you have suggestions for future resources that would support the development of local wellness policies and implementation plans, please email me at helenka.ostrom@texasagriculture.org. Thank you all for taking the time today to learn more about local wellness policies and SHACs.
Okay. Thank you, Helenka. You noticed earlier that Mario had provided some resource links for school health advisory councils. We've also added a few more resource links. He had mentioned the SHAC guide. TEA has a list of all the laws. And then, of course, Helenka talked about the squaremeals.org. And then we also mentioned It's Time Texas. As far as developing policies themselves, NASB has state school health policy database. So if you're looking for sample policies, you can go there and you will find all kinds of different policies. Then the CDC has their Whole School, Whole Community, Whole Child website, which is very helpful if you're looking at different aspects of school health, not just focusing on nutrition or physical activity, looking at the whole child. If you have a policy and you want to see how strong it is, the Rudd Center has developed a WellSat, which is an analysis tool. And it is a set of questions that you can answer, and then it will let you know where you need to be working on your wellness policy, what areas you're being successful in, and what areas you might want to focus on. And then there's also to see about the implementation. The CDC has a School Health Index. Action for Healthy Kids also has a shorter version of School Health Index. They're free resources that the district can actually enter some of the information where it's the same across the district, and then the individual campuses would enter their information, and it would tell you where you're being successful on implementation and where you might need some additional work. So these are all tools that can help you with your wellness policies. I did want to mention our fall summit is coming up on Monday, and it will be in Austin. If you are available, we would love to have you there. We have a very good agenda that will involve more discussion around wellness policies and SHACs. Also, alternative breakfast programs. We have the board chair from ASCD who's going to come and share information on that whole child model. And then we have the CATCH team and 3 school districts who are going to talk about whole child implementation as well as coordinated school health. So it's a great agenda. If you're available, you can go to our national website and /events, or you can shoot me an email and I can send you a direct link. If there are any questions, we would love to have you answer. Gretchen is asking, is this something Extra Healthy Kids might take on as a resource to SHACs? Gretchen, I'm not sure what you're asking. Let me see if I can find you. I will unmute you and you can explain what you're trying to, what is it you're wanting to know specifically?
Can you hear me, Michelle?
Yeah.
Great. So I lead the SHAC Parent in Capel ISD, and we have a lot of challenges, I guess you could say, in terms of finding speakers for the social emotional part of SHAC, you know, drug awareness, anxiety, social media. We've brought a lot of great speakers in the past. They are expensive. Obviously, as you all know, SHAC is not, we don't have a budget for SHAC.
Right.
There's a way that, I don't know if this is something Action for Healthy Kids could take on, or having a resource list of speakers in Texas that would offer their services. And I'm not asking for free, but maybe at a discount, or we could collaborate with other districts that are nearby to kind of share resources. We find that that's a big challenge for us.
So if you want to look, we've done a couple of webinars on SEL. And those have provided some resources. Now, they have not provided speaker options for the state of Texas. But that is something where I feel like there are some school districts that have been pretty successful. EPISD has done a lot of SEL work through their recess. Austin ISD has done some significant work around SEL. There are districts that I think you could pull people from, possibly in your area or within the state at least, that could address your SHAC. So I will look and see what I can add to the email that goes out after this as far as SEL resources go.
Great, thank you.
Are there any other questions? I did have one. Let me see, Mario. I'm going to go back to my panelists here so I can unmute you guys. Can you talk about what your parent university involves?
That is within our school district, you know, the group that's in charge of the parents that goes through our federal programs. It's kind of like the catchy title that they have when they meet. They call it a parent university, but that's where they attract their parents. And what I do is usually when they meet, I usually go and give them a quick SHAC report or whatever's happening in my department. So that's really what that is. But the strategy was that I went to those meetings to recruit and to inform them about SHAC more than anything. That is what the strategy was, not to just not be, you know, go to them. And that's my advice to everyone is we all have those kind of groups. And, you know, how do you find yourself going to those groups to let them know about the SHAC? And you'd be surprised on many occasions, some of the parents have been real active. Somehow along the line, they didn't even know about the SHAC. So it just gives me another opportunity to use public relations best practices to inform parents about our SHAC.
Okay, thank you. If there are any other questions, okay. Let's see here. I think I see one more. We are not live streaming we were going to live stream or record the summit. We can't live stream it, or we're not live streaming it, but we are recording it. So we do plan to post that after the fact. We're doing several panels, so there won't be PowerPoints. It's going to be more talk show host type thing. So we felt like if we could record those, either they could be great podcasts or there'll be some static video, but yes, we will have those available after the summit. Any other questions? I want to thank our panelists. You guys did an excellent job. Thank you, Helenka, for sharing information. There's a state wellness policy committee that multiple agencies serve on and several school districts. So they're always engaging different organizations and school districts on how to better support wellness policies, and are always open for new ideas and new ways that they can support. Mario is a wealth of information on SHACs. He has worked as a SHAC leader for so long and has been recognized for his hard work and is greatly appreciated. I'm excited about the summit and hope that some of you might be able to join us. Look for a list of potential webinars for the spring. And if you have suggestions for webinars that you feel would be useful or beneficial to you or your school district, shoot me an email and we can certainly consider that. We try to focus on areas that we get a lot of requests for information on. School Health Advisory 101, because there's a lot of turnover, is one that we have repeated multiple times, how to engage parents. We've done a couple on SEL, we've done recess. So you will find a lot of those online. We even have one on there that's what is the law. So if you want to understand what the law is, you can watch the video and it goes through every law that was created around school health advisory councils. Thanks for sharing part of your day. We appreciate you being with us today and hope you have a great weekend. I hope you're not iced in, and have a wonderful holiday season, and we will be back with you in the new year. Thanks.